Thank you. First of all, I'd like to thank the organizers for the opportunity to participate in this wonderful event. I speak from the perspective of a healthcare provider, not only a healthcare provider, but one who's been involved in over 100 procurements of organs, in my case, hearts, and from the perspective of a medical provider who provides services to patients with end-stage heart failure, and who does the transplants now. My journey in this field started when I was training to be a heart surgeon about 10 years ago, and I became very interested in transplantation and heart transplantation because very quickly I saw that transplantation was one area in medicine that resulted in a very, very dramatic change in people's lives. You take them from almost death's doorstep to living a very healthy and active life in the vast majority of cases, where they can go back to their families and go back to work and provide participation in our society. From the medical perspective, organ donation starts with a very tragic event, and it's the death of a loved one. It does not start before then. There are myths that healthcare providers are out there looking for organs. That's absolutely not the case. When a loved one dies, particularly in the classical sense, when they have a neurologic form of death, either a trauma where their brain has been damaged, or a stroke, or some other form where their brain function is so damaged that there is no brain function left, that's when a patient is typically declared neurologically dead. And brain death is death. There are also myths that if the heart's still beating, patients are still alive. But we have for many, many years certified patients as being brain dead when there's an absence of brain activity, where we know that they're never going to come back. And I think that's the first hurdle for a lot of families to understand. Two physicians do a number of tests, neurologic tests, where they ensure that there's no brain activity, there's no spontaneous breathing, and there are no reflexes. And so if there's any question, there are further tests done to be absolutely sure that brain death has occurred. Once brain death has occurred, then that's communicated to the family. And with that, families are approached at that point, but no earlier, about their wishes or their loved ones' wishes regarding organ donation. And unfortunately, if discussions had not been made prior, families are left to sometimes wonder what their family's wishes are. And so it's very important that we begin the discussion for the families, because if you leave your loved ones with making that decision, they may not know, and they may default to, well, we don't know, so we don't want to provide that consent. And it truly is up to the family in the end to say yes or no. And so it's very important that your family members know about your wishes. So once someone's declared brain dead, family members are approached, and if they do feel that if you're the one who has died, would have wanted your tissues and organs donated, then the process begins with regard to contacting Trillium Gift of Life Network. There are coordinators who will come speak to families and discuss the process and go over specific concerns or questions. If a family member or the next of kin do consent to tissue or organ donation, they'll talk to you about whether that's for research purposes or medical purposes or both. The vast majority of organs are truly used for medical purposes. There are instances where if they're not usable or suitable, they may be still beneficial to society in terms of being able to do research to advance the field of organ transplantation, and that's something that I'm involved with. There may be tests that are required to determine suitability of organs, blood tests, x-rays, bronchoscopies to look in the lungs, angiograms to look at the heart blood vessels. So all of these things can occur after the declaration of brain death to determine organ suitability. Once that's done, there's a process that Trillium Gift of Life goes through to match organs to recipients, and that can be across the country. And if there's no match within the country, then it actually is offered to the U.S. as well, and the U.S. offers us organs as well. So there's sharing. So we absolutely try to utilize every single organ possible. So once the organs are allocated, which does take a period of time, up to a day or two in some cases, and all the tests, then we proceed on to the next step, which is the actual organ donation procedure. At that time, the patients typically have been in an ICU and they're transferred to an operating room. We do ask family members if there's anything that they would want done in the operating room, religious symbols or music or things. We respect all of that. And so I've been in many instances where religious articles have accompanied the donor to the operating room, and we absolutely respect all of that. Once the donor is in the operating room, then the procedure begins. We remove the organs, and some wonder what tissues can be donated. Organs are pretty easy to understand: heart, lung, kidneys, liver, pancreas. But tissues such as corneas, tissues such as bone, ligaments, or even in the case of hearts, if your heart's unfortunately damaged, we may not be able to use your heart, but some of the valves can be used to help other people undergoing complex operations. And so that's the type of tissue that can be used from organ donation. The process in the operating room essentially is that all the donor teams come from around the country. For each organ, we do an operation to expose the organs, and then we flush everything with a cold preservation solution and remove them from the deceased, and then we leave the deceased closed for transfer to funeral services. And so people wonder whether or not there will be some disfigurement or something that looks bad. We don't typically worry about that, and we absolutely leave the patients in a state that the funeral home can address to present patients in an appropriate fashion. So I think that's a concern that people really shouldn't have. Once the organs are removed, then we rapidly transfer them to the donor sites, cooled in coolers, and then we proceed with the transplant operation, which can take many hours thereafter. So the process is pretty straightforward. There's a lot of respect for families' wishes. There's a lot of opportunities for questions to be answered. But at the end of the day, any of the myths that people have in their minds about organ donation, I think it's incumbent on people like me to dispel those myths. And I think opportunities like this are very important. I grew up in Mississauga. I grew up in the South Asian community, and I know that there's a lot of lack of information and misinformation. And I think I welcome further opportunities to help in this regard, because I think it's very, very important. You truly can change the lives of a number of individuals, and organ donation is really, really rare, considering the number of patients who would benefit from organ donations. For heart transplants, for instance, we have many, many, many patients waiting for very few organs. And so from the research side, we're doing all that we can to try and improve the numbers of organs that we can utilize because of that dramatic crisis and the inavailability of organs. So everything that we can do to improve the organ donation rates is something I think we as South Asians should be involved in.